Good day, everyone. This is the first chapter of Gross Anatomy 1, the Introduction to Basic Anatomy. It is essential that students understand the terms used for describing the structures and function of different regions of gross anatomy. Without this, it is impossible to describe in a meaningful way the composition of the human body. So we as dentists, we need to know these anatomic terms for us to be able to record accurately our clinical examination findings. So this is basic anatomy. We will define each terms. So we are faced with a 65-year-old man who was admitted to the emergency department complaining of sudden onset of a severe crushing pain over the front of the chest, spreading down the left arm and up into the neck and jaw. He said that he had several attacks before and always occurred when he was climbing stairs or digging in the garden. So the discomfort disappeared with rest after about 5 minutes. So ano kaya nangyari dito sa patient? So our answer here is angina. What is angina? Angina is a form of cardiac pain that occurs on exertion and disappears on rest. It is caused by narrowing of the coronary artery so that the cardiac muscle has insufficient blood. Same occasion, the pain here was more severe and had occurred spontaneously while he was sitting in a chair. The pain had not disappeared. So this time, the patient is suffering from myocardial infarction, in which the coronary blood flow is suddenly reduced or stopped and the cardiac muscle degenerates or dies. So myocardial infarction is a major cause of death in industrialized nation. So clearly, the knowledge of the blood supply of the heart and the arrangement of the coronary arteries is the paramount importance in making the diagnosis and treating this patient. That is why it is very important to study anatomy. Okay, so what is anatomy? Anatomy is the science of the structure and function of the body. Clinical anatomy is the study of the macroscopic structure and function of the body as it relates to the practice of medicine and other health sciences. So that includes dentistry. Well, basic anatomy is the study of the minimal amount of anatomy consistent with the understanding of the overall structure and function of the body. So what is anatomic position? Here you can see that the person is standing erect with the upper limbs by the sides and the face and palms of the hands directed forward. So ganito ang hitsura pag sinabihin nating anatomic position. So we will always go back to this position as our reference. So it is important for medical personnel to have a sound knowledge and understanding of the basic anatomic terms. Okay, there are planes that we need to understand. First, we have the median sagittal plane. This one, the blue line. Okay, median sagittal plane is a vertical plane passing through the center of the body. Okay, dividing it into equal right and left halves. Okay, so planes naman situated to one or other side of the median plane are parallel to it are termed para-median plane. Ito naman siya. Okay? If this is the median plane, yung gitna, yung parallel sa kanya is the para-median plane. A structure, for example, situated nearer to the median plane, nandito siya, mas near siya sa median plane of the body than another structure na nandito, okay, is said to be medial to the other. Okay? Medial, mas malapit doon sa gitna. Okay. So a structure that lies further away, nandito na when compared to a structure that is located here, is said to be away, no, from the median plane, then another is said to be lateral to another. Coronal plane, this is the coronal plane, the pink one, because it follows the coronal suture of the skull. Okay, these are imaginary vertical planes at right angles to the median plane. Then we have horizontal or transverse planes. So these planes are at right angles to both the median and the coronal plane. This one, the yellow line. Ano naman to anterior and posterior? So that is very basic. So this is used to indicate the front and back of the body respectively. Okay, so one is said to be anterior or posterior to the other insofar as it is closer to the anterior body surface or posterior body surface yung sa likod. When we're talking about the hand, kamay, we have the palmar and the dorsal surface. This is used in place of anterior and posterior. So pag kamay, we don't designate them as anterior, posterior. Instead, it's palmar and the dorsal surface. Paano naman pag sa paa? Sa foot, we have plantar and dorsal surfaces instead of lower and upper surfaces. Okay, so proximal and distal. So this describes the relative distances, no, from the roots of the limb. Example, the arm is proximal to the forearm and the hand is distal to the forearm. Okay, so another one, superficial and deep. So this denote the relative distances of structures from the surface of the body. Kung superficial or kung sa ilalim, that is deep. Okay? Then superior and inferior. This denote levels relatively high or low with reference to the upper and lower ends of the body. This is used to describe the relative distance of a structure from the center of an organ. Example, the internal carotid artery is found inside the cranial cavity and the external carotid artery is found outside. How about ipsilateral? Pag sabihin natin ipsilateral, ano yun siya? This refers to the same side of the body. So same side, that is ipsilateral. Okay? So your right hand, no, the right hand and the right foot, they are ipsilateral. The same way as your left hand and the left foot are ipsilateral because they are on the same side. Ano yung contralateral? Contralateral is the opposite side. So kung right dito sa kamay, left sa paa, they are contralateral to each other. Okay? So what is supine and prone? Say supine, you are lying on your back. If you say prone, nakadapa. You are lying face downward. Okay? So we also have here, no, the different descriptive anatomic terms related to movement. Okay. So we have first the joint. Ano ba yung joint? So it is a site where two or more bones come together. Remember ha? Two or more bones come together. We call that one a joint. Some joints have no movement, no? Like the suture ng ating skull. Wala namang movement na nangyayari dyan. But still, that is a joint. Some have only slight movement. Merong konti lang. Like your tibiofibular joint. Others, no, they are freely movable, just like your shoulder joint. It's freely movable. You can move your shoulder joint. Okay? Then another movement we have is flexion. What is flexion? No, when we try to flex, it is a movement that takes place in a sagittal plane. Okay? Sample. Flexion of the elbow joint approximates the anterior surface of the forearm to the anterior surface of the arm. So that's how we flex. It is usually an anterior movement, but it is occasionally posterior, just like in the case of your knee joint, di ba? When you try to flex your knee joint, di ba? So, papunta sa likod or posterior. What is extension? Extension means straightening the joint and usually takes place in a posterior direction. Yung lateral flexion naman is a movement of the trunk in the coronal plane or sideways. That is lateral flexion. Then we have abduction and adduction. Ano ba yun sila? If we say abduction, that is the movement of the limb away from the midline of the body in the coronal plane. So that is abduct, no? Parang kinuha. Okay, movement away, that is abduction. Adduction naman is the opposite. It is a movement of the limb toward the body in the coronal plane. Okay? So, for example, your fingers and toes. If you say abduction is applied to spreading. You spread your fingers, that is abduction. Okay? While adduction is applied to the drawing together of these structures. So, pag ganyan, pag away, that is abduction. Pag ganyan, that is adduction. Claro. What about your rotation? If you say rotation, that is the movement of a part of the body around its long axis. Like medial rotation for this figure is the movement that results in the anterior surface of the part facing medially. Okay? Papasok. Okay? Medial rotation. Lateral rotation is the movement that results in the anterior surface of the part facing laterally, palabas, like this one. That is lateral rotation of the shoulder joint. How about pronation and supination? If we say pronation of the forearm, what do we mean by that? This is the medial rotation of the forearm in such a manner that the palm of the hand faces posteriorly. Okay? So that is pronation. While supination naman, just like in this picture, is a lateral rotation of the forearm from the pronated, di ba pronated nakatalikod? From the pronated position so that the palm of the hand comes to face anteriorly. So that is supination. This one, pronation. What is circumduction? Circumduction is the combination and sequence of the movements of flexion, extension, abduction, and adduction. Okay? Combine sila, that is circumduction. Still, descriptive terms related to movement. Okay? Protraction. Ano ba yung pinoprotract? What is protraction? Like this jaw, no? Our jaw, pag i-move natin siya forward, okay? That is protraction. To move forward. Retraction is the opposite. To move backward ng jaw. For example. So used to describe the forward and the backward movement of the jaw at the temporomandibular joint. Okay? What is inversion and eversion? Pag sabihin natin inversion, no, kung paato, pasok. Okay? That is invert. Is the movement of the foot so that the sole, for example, ito, no, faces in a medial direction. While eversion is, of course, the opposite, palabas, just like this picture, okay? It's the movement of the foot so that the sole faces in a lateral, no, palabas na direction. Okay, so let's go to the basic structure. So all of the things that we're going to talk about in chapter 1 are all basic. This is only the introduction of what is there in the next few chapters. Okay, so basic structures, we have the skin, the fascia, the muscle, joints and ligaments. We will talk about all these things, no? A konti-konti. The blood vessels, the lymphatic system, nervous system, the membranes. Okay, of course, the bone and embryology and clinical anatomy. Okay, if we say the skin, if we say the skin, of course, there are two things in mind. We have the epidermis and the dermis. Okay? Pag sabihin natin epidermis, yan yung nasa superficial layer. Okay? It is a stratified squamous epithelium whose cells become flattened as they mature and rise to the surface. Okay. Pag sabihin naman nating dermis, eto na yun. Yung mas malaking area. It's composed of dense connective tissue containing many blood vessels, lymphatic vessels, and nerves. Connected to the underlying deep fascia or bones by the superficial fascia, otherwise known as or subcutaneous tissue. So aside from the skin, no, there are appendages of the skin. Ano etong mga appendages? You have nails, the hair follicles, sebaceous glands, and sweat glands. Pag sabihin nating nail, etong kuko, ito, keratinized plates on the dorsal surfaces of the tips of the fingers and toes. They are keratinized. Okay? The proximal edge of the plate is the root of the nail. Okay? So meron siyang root portion. It is surrounded and overlapped by skin folds of skin known as your nail fold. So meron siyang nail fold. And then the surface of the skin covered by the nail is, yung sa ilalim, is the nail bed. Okay? How about the hair? How about the hair? So, the hair grows out of follicle. So, gaya nito, di ba? You have hair. You have here the hair follicle, no? And you have here the hair bulb. Okay, it grows out of follicles which are invaginations of the epidermis into the dermis. The hair bulb is concave at its end, okay? And the concavity is occupied by vascular connective tissue called the hair papilla. We also have a muscle dito sa hair. There's a band of smooth muscle. We call this muscle erector pili muscle, okay? It connects the undersurface of the follicle to the superficial, no, part of the dermis. So, in this picture, you have the erector pili muscle here. Ayan. So, it connects the undersurface of the follicle to the superficial part of the dermis. Okay, so the muscle, ito siya, the erector pili muscle, it is innervated by sympathetic nerve fibers, and its contraction causes the hair to move into a more vertical position. So when this muscle contract, tumatayo yung balahibo, okay, the hair. It also compresses the sebaceous gland, okay, and causes it to extrude some of its secretions. So pag tumayo yung mga balahibo mo, ganyan, it is because of the contraction of your erector pili muscle. Okay? So the pull of the muscle also causes dimpling of the skin surface, which we call goose flesh or goose bumps. Okay? Hair are distributed in various numbers over the whole surface of the body. Kaso, there are areas in the body na walang hair, di ba? So, except on the lips, wala namang hair sa lips. The palms of the hand, okay, walang mga hair yan. The sides, no, of the fingers, the gland penis, the clitoris, the labia minora, and the internal surface of the labia majora, and the soles and sides of the feet and the sides of the toes. So these are areas devoid of hairs. Okay. This sebaceous gland pour their secretion, which we call the sebum, into the shaft of the hairs as they pass up through the necks of the follicles. So they are situated on the sloping undersurface of the follicles and lie within the dermis. So nakatira si sebaceous gland sa dermis. Ano yung nilalabas niyang secretion? We call that one sebum. Sebum is an oily material that helps preserve the flexibility of the emerging hair. So meron palang purpose yung sebum. Okay? How about yung sweat glands? Ito naman siya, the spiral one. Okay? They are long, spiral, tubular glands distributed over the surface of the body, except on the red margins of the lips. Walang sweat glands yan. Okay? The nail beds, of course, walang sweat glands, the glands penis, and the clitoris. So extended through the full thickness of the dermis and their extremities may lie in the superficial fascia. and most deeply penetrating structures of all the epidermal appendages is your sweat gland. So makita mo dito sa picture, mas deeper nga naman yung abot ng iyong sweat gland. Okay, let's go to clinical notes. So when we say infections, ano ba itong mga infections? And what are the structures na pwedeng ma-infect? So the nail folds, the hair follicles, the sebaceous glands are common sites for entrance into the underlying tissues of pathogenic organisms such as your Streptococcus aureus, diba? They live in the skin, so they can easily infect no, the nail folds, the hair follicles, the glands, diba, na pwedeng mag-swell eventually. So this infection occurring between the nail and the nail fold, we call this one paronychia. Okay, paronychia. So infection of the hair follicle and sebaceous gland is responsible also for common boil or yung mga pigsa. Okay. So a carbuncle is a staphylococcal infection of the superficial fascia. It frequently occurs in the nape. Yung iba, meron dito. Di ba may mga pigsa-pigsa in the nape of the neck and usually starts as an infection of a hair follicle or a group of hair follicles, yung carbuncle. So ano bang itsura ng mga to? Okay. So this one, this picture, no, it's a picture of a furuncle. So maybe at one point, nagkaroon kayo ng ganito, no? And this one, medyo mas severe form is the carbuncle. Okay, they're caused by your Staphylococcus organism. Okay, now let's go to fascia. When we say fascia, ano ba tong fascia? Meron tayong superficial na fascia, merong deep or mas nasa ilalim na fascia. Okay? So kung may superficial, merong deep. So in this picture, what you can see, etong green no, surrounding this muscle is the deep fascia. So, mas superficial sa kanya, of course, is the superficial fascia. Okay? They usually lie between the skin and the underlying muscles and bones. So when we say superficial fascia, also known as subcutaneous tissue, this one, it is a mixture of loose areolar and adipose tissue that unites the dermis of the skin to the underlying deep fascia. It contains numerous bundles of collagen fibers, so may mga collagen fibers dito, that hold the skin firmly to the deeper structures. And then, in the eyelids, no, sa mata, sa ears, sa auricle of the ear, sa penis and scrotum and clitoris, it is devoid of adipose tissue. Walang adipose tissue. Ano naman yung deep fascia? Okay, the deeper layer, this one. So it is a membranous layer of connective tissue that invests the muscles and other deep structures. In the neck, it forms well-defined layers that may play an important role in determining the path taken by pathogenic organisms during the spread of infection. In the thorax naman and abdominal area, it is merely a thin film of areolar tissue covering the muscles and aponeurosis. So during dissection, especially sana kung dun sa cadaver, you will appreciate this fascia. Nakikita naman ito sila. In the limbs, it forms a definite shape, parang para siyang plastic na nakabalot, no? It forms a definite sheet around the muscles and other structures, holding them in place. Sa kamay naman, in the region of the joint, the deep fascia may be considerably thickened, makapal siya to form restraining bands like this one. This is called a retinacula. So their function is to hold underlying tendons in position or to serve as pulleys around which the tendon may move. Okay, so parang band nakaikot siya. Or else, this cannot function very well kung walang nakaipit. Okay? Now, let's go to muscles. Ano ba itong mga muscles na to? This is quite a review, no? From your previous courses, topics. Okay, so we have three types. We have skeletal, smooth, and the cardiac muscle. Okay, if we say skeletal muscle, they produce movements of the skeleton. Okay, they are voluntary. They are made up of striped muscle fibers. It has two or more attachments, and the attachments that moves the least is referred to as the origin. So this area moves the least, hindi kaya siya nagalihok. So that's your origin. And the one that moves most is the insertion. Okay, this muscle, no, is your gastrocnemius. Okay, so if ever this muscle contracts, it will pull this insertion part into the origin. So, magko-contract, liliit siya, pulling this area up. So, just imagine, no, kung ano yung pwedeng maging movement ng iyong paa. Okay. So, the ends of a muscle, may mga dulo-dulo man talaga yung muscle, di ba? So, yung ends niya are attached to either to the bone, to a cartilage, to a ligament, no? By cords of fibrous tissue we call tendons. Okay. So, there are also flattened muscles, no? That are attached by a thin but strong sheet of fibrous tissue, and we call that one aponeurosis. Yung iba sa aponeurosis, nakadikit. Okay? Ano ba yung internal structure ng skeletal muscle? So, muscles whose fibers run obliquely to the line of pull are referred to as pennate muscle. They resemble a feather. Unipennate muscle is one in which the tendon lies along one side of the muscle and the muscle fibers pass obliquely to it. Okay, that is unipennate. Ganito ang hitsura. Pag bipennate naman is one in which the tendon, etong green, nasa gitna. The tendon lies in the center of the muscle and the muscle fibers pass to it from two sides. Merong nandito, merong nasa kabila. Just like your rectus femoris. So rectus femoris is an example of a bipennate muscle. Extensor digitorum longus is an example of a unipennate muscle. Okay, remember that one. Okay, how about multipennate muscle? Multipennate muscles are arranged as a series of bipennate, parang maraming bipennate muscle lying alongside one another. Sample your acromial fibers of the deltoid, okay? Or may have the tendon lying within its center and the muscle fibers passing through it from all sides, converging as they go, just like tibialis anterior muscle, okay? So both tibialis anterior muscle and the acromial fibers of the deltoid are multipennate muscle. Okay? Pennate muscles have many more fibers compared to muscles with parallel fiber arrangements and are therefore more powerful. Okay, mas powerful itong si multipennate muscle. Still on the internal structure of the skeletal muscle, here we can see different pala yung mga shapes ng muscle. There are muscles whose shape is rhomboid, merong quadrilateral, merong na-strap ang hitsura, okay, merong fusiform, pag ganito, merong dalawang bellies, merong dalawang heads, okay, there, may muscle na triangular pala ang shape. Okay, and this is one way of naming a muscle also based on the shape. But there are other ways of naming muscles. Okay, so ano yung skeletal muscle action? So all movements are the result of coordinated action of many muscles. When we produce a single movement, hindi lang yun isang muscle lang nag-act. Okay? Maraming muscle na nag-act in coordination just to produce no a movement. Okay. A muscle may work in four ways. Okay? Pwede siyang prime mover. Pag sabihin nating prime mover, okay, a muscle is a prime mover when it is the chief muscle or member of a chief group of muscles responsible for a particular movement. Just like in this picture, the quadriceps femoris here, na nasa thigh nyo, okay, is a prime mover in the movement of extending the knee. So pag when we extend pala the knee, no, ang nag-work pala na muscle, ang prime mover pala is the quadriceps femoris. Okay? Siya ang prime mover. So kung siya ang may prime mover, ano naman ang tawag dun sa ibang muscle? So another muscle will be the antagonist. Okay? Any muscle that opposes the action of the prime mover is an antagonist. So in this case, kung ang prime mover natin is the quadriceps femoris, ang ating antagonist which is behind the quadriceps femoris is your biceps femoris. So the biceps femoris opposes the action of your quadriceps femoris when the knee joint is extended. So that is one application already. Pero hindi lang sila dalawa. Pwede ring may fixator. So a fixator naman contracts isometrically to stabilize the origin of the prime mover so that it can act efficiently. Murabag na itagapugong, di ba? So, contraction increases the tone but does not in itself produce movement. So, yan yung ginagawa ng fixator. Example, the muscle attaching the shoulder girdle to the trunk contract as fixators to allow the deltoid to act on the shoulder joint. Then the last one is synergist. So this is to prevent unwanted movements in an intermediate joint group of muscles called synergists contract and stabilize the intermediate joints. Diba? Mahirap din sa finger na i-move mo isa lang. But usually, nagmo-move din sila lahat. Okay? The synergists prevent these unwanted movements. So the flexor and extensor muscles of the corpus contract to fix the wrist joint, and this allows the long flexor and extensor muscles of the fingers to work efficiently. Ano naman yung nerve supply ng mga muscles na to? So the nerve trunk to a muscle is a mixed nerve. 60% is motor and 40% is sensory. So the nerve enters the muscle at about the midpoint on its deep surface, often near the margin. So the place of entrance kung saan papasok yung nerve is known as the motor point. Then now we'll go to the naming of skeletal muscles. So individual muscles are named according to their shape, their size, the number of heads or bellies, position, the depth, attachments, or action. Okay, for example, 'di ba? You saw a picture earlier kung ano yung may 'di ba may mga muscles na triangular. So triangular, you have deltoid, okay? Teres, they are round. If you say rectus, they are straight. Say major, they are large. Okay? If you say latissimus, broad sila. Longissimus, long. Biceps, 'di ba? So dalawa, two heads. Pag quadriceps, just like your quadriceps femoris, 4 heads pala siya. Then the digastric has two bellies. Okay? So, kaya sila naniname. Maraming pwedeng because of the size, the shape, the number of heads or bellies, position, depth, and attachments or action. Okay, so that's for the skeletal muscle. Now let's go to smooth muscle. So smooth muscles consist of long spindle-shaped cells closely arranged in bundles or sheets. Okay? Saan natin sila makikita? So you can find the smooth muscles in the digestive system. They cause peristalsis in the digestive system. We can also find this smooth muscle in the urinary bladder and the uterus. So contraction is slow and sustained and brings about expulsion of the contents of the organ. So that is the work of your smooth muscle. Okay. In the walls of blood vessels, we can also find the smooth muscle fibers. They are arranged circularly and serve to modify the caliber. Minsan maliit, minsan malaki. They modify the caliber of the lumen of these blood vessels. Okay. Then lastly, the cardiac muscle. So this consists of striated muscle fibers that branch and unite with each other and forms the myocardium of the heart. Fibers are arranged in whorls and spirals, and they have the property of spontaneous and rhythmic contraction. Hindi naman natin iniisip, di ba? But our heart continues to contract. Okay, that is the beauty of your cardiac muscle. It is supplied by autonomic nerve fibers that terminate in the nodes of the conducting system and in the myocardium. Okay, so more on the muscles. Let's go to joints. Ano naman tong joints? Joint is a site where two or more bones come together, whether or not movement occurs between them, 'di ba? Kasi sabi nga natin, yung skull naman, meron naman siyang joint, 'di ba? So, pero hindi naman nagkakaroon ng movement. So, joint pa rin. It is classified according to the tissues that lie between the bones. So, pwede siyang fibrous joint, cartilaginous, and synovial. Okay? Fibrous, cartilaginous, and synovial. Pag sabihin natin fibrous, the articulating surfaces of the bones are joined by fibrous tissue and thus very little movement is possible. Saan ba natin makikita yung very little movement or to no movement, di ba? So, example is the suture of the vault of the skull and the inferior tibiofibular joint. Next is the cartilaginous. Ano ba yung cartilaginous? There are two types, yung primary and secondary cartilaginous joint. If we say primary cartilaginous joint, the bones are united by a plate or bar of hyaline cartilage. Okay? Remember, meron siyang hyaline cartilage. Here, no movement is possible. Okay? No movement. So example is the union between the epiphysis and the diaphysis, okay, of a growing bone, and that between the first rib and the manubrium sterni. So no movement there. It is a cartilaginous joint. What about the secondary naman, cartilaginous joint? Kasi may primary, so may secondary. So the bones are united by a plate of fiber cartilage, and the articular surfaces of the bones are covered by a thin layer of hyaline cartilage. There's a small amount of movement. Small amount of movement is possible. So joints between the vertebral bodies, yung sa spine, no, the vertebra, joints between them, no, that is a cartilaginous joint. And of course, the joint, no, in the symphysis pubis, cartilaginous yan. Lastly, the synovial, okay? If we say synovial joint, the articular surfaces of the bones are covered by a thin layer of hyaline cartilage separated by a joint cavity. This arrangement permits a great degree of freedom of movement. So may movement na talaga if we say synovial joint. So the cavity of the joint is lined by a synovial membrane. So the synovial membrane is protected on the outside. Sa labas, meron siyang tough fibrous membrane referred to as a capsule of the joint. So in the picture, ayan, kita natin yung capsule. The articular surface are lubricated by a viscous fluid called synovial fluid, which is produced by the synovial membrane. So, meron tayong fluid dito. This one, the synovial membrane. So, merong fluid kasi it's movable, di ba? Yung ating synovial joint. So, under the synovial joint, may classification. Ito siya. Marami sila. Synovial joints can be classified according to the arrangement of the articular surfaces and the types of movement that are possible. So, first, classification. We have plain joint. Yan, isa na yan. So, the opposed articular surfaces are flat or almost flat, and this permits the bones to slide. Kasi plain sila eh. To slide on one another. That is a plain joint, no? Which is a synovial joint. Example here is your sternoclavicular. That is from the sternum and the clavicle. Sternoclavicular joint and the acromioclavicular joint. Okay? Plain joint yan sila. Another one is hinge joint. Ano yung hinge joint? Symbol the hinge on a door. Diba? Sa door. Ganyan. So that flexion, pwedeng ma-flex, extend. Movements are possible. Example, the elbow, the knee, and the ankle joints. Hinge joint sila. Okay? Make sure you know the different classifications of synovial joints and their examples. Another one, pivot joint. So a central body pivot is surrounded by a bony ligamentous ring. Okay. Rotation is the only movement. Remember, in pivot joints, rotation is the only movement possible. Example, your atlantoaxial and superior radio-ulnar joint. The atlantoaxial, di ba? From C1, C2, di ba, rotation lang ang pwede. That is a pivot joint. Other one, we have your condyloid joints. They have two distinct convex surfaces that articulate with two concave surfaces. Saan ba to? Ano ba itong mga movements? Pwedeng may flexion, extension, abduction, adduction, are possible together with small amount of rotation. So, example, sa metacarpopharyngeal joint or your knuckle joint. So, yan sila, no? Etong sa kamay, they are condyloid joint, which is still a synovial joint. Another one is the ellipsoid joint. Okay, an elliptical convex articular surface fits into an elliptical concave articular surface. Flexion, extension, abduction, adduction can take place, no, in your ellipsoid joints. Rotation here is impossible. The best example is the wrist joint. Wrist joint, ellipsoid joint. Okay, still a synovial joint. Then we have saddle joints. Saddle joints, the articular surfaces are reciprocally concavo-convex and resembles a saddle on a horseback. Ganito ang itsura. Okay, permit flexion, extension, abduction, adduction, and rotation. Example is your carpo-metacarpal joint of the thumb. Then we have ball and socket joint. A ball-shaped head of one bone, just like this one, the head of the femur, fits into a socket-like concavity of another bone. This is the hip bone. So, this permits free movements including flexion, extension, abduction, adduction, medial rotation, lateral rotation, and circumduction. Okay, shoulder, tsaka hip, that is a ball and socket joint. Okay, so let's go to the nerve supply of joints. So, of course, meron siyang nerve supply. Okay, the capsule and ligaments reserve an abundant sensory nerve supply. A sensory nerve supplying a joint also supplies the muscles moving the joint. So, not just the joint lang ang sinusuplayan, pati yung muscle. Okay, and the skin overlying the insertions of this muscle. This is a fact that has been codified as the Hilton's law. And let's go to ligaments. So a ligament is a cord or band of connective tissue uniting two structures commonly found in association with joints. So there are two types composed of dense bundles of collagen fibers and are unstretchable under normal conditions. For example, the iliofemoral ligament of the hip joint and the collateral ligaments of the elbow joint. It is composed largely of elastic tissue and can therefore regain its original length after stretching. So example is ligamentum flavum of the vertebral column and the calcaneonavicular ligament of the foot. Ano naman tong bursa? Bursa is a lubricating device consisting of a closed fiber sac lined with a delicate smooth membrane. So its walls are separated by a film of viscous fluid and found wherever tendons rub against bones, ligaments, or other tendons. So it's commonly found close to joints where the skin rubs against underlying bony structure. So in this picture we have here, this is the knee kasi nandito yung patella. Okay? One of the biggest floating bone. Then sa taas niya, you have here your suprapatellar bursa. Then you have here the prepatellar bursa in the superficial and deep infrapatellar bursa. Okay. So kung may bursa, meron ding sheets, synovial sheets. Ano ba tong synovial sheets? It is a tubular bursa. Bursa pa rin siya. That surrounds naman a tendon. So, binabalot niyo yung tendon. So, the tendon invaginates the bursa from one side so that the tendon becomes suspended within the bursa by a mesotendon. So, this mesotendon now enables blood vessels to enter the tendon along its course. So, this occur where tendons pass under ligaments and retinacula and through osteofibrous channels or tunnels. Their function is to reduce friction between the tendon and the surrounding structure. Okay, reduce friction. Okay, so that's the last slide for the first part of chapter 1. So, sabi nga dito, ang tulog na babawi, ang grade hindi. So, this is the first chapter pa lang. So, please make good. And this next chapter will be ready for the next session. Keep safe, everyone. Bursa is a lubricating device consisting of a closed fibrous sac lined with a delicate smooth membrane. So its walls are separated by a film of viscous fluid and found wherever tendons rub against bones, ligaments, or other tendons. So it's commonly found close to joints where the skin rubs against underlying bony structure. So in this picture we have here, this is the knee kasi nandito yung patella. Okay? One of the biggest floating bone. Then sa taas niya, you have here your suprapatellar bursa. Then you have here the prepatellar bursa in the superficial and deep infrapatellar bursa. Okay. So kung may bursa, meron ding sheaths, synovial sheaths. Ano ba tong synovial sheaths? It is a tubular bursa. Bursa pa rin siya. That surrounds naman a tendon. So binabalot niyo yung tendon. So the tendon invaginates the bursa from one side so that the tendon becomes suspended within the bursa by a mesotendon. So this mesotendon now enables blood vessels to enter the tendon along its course. So this occur where tendons pass under ligaments and retinacula and through osteofibrous channels or tunnels. Their function is to reduce friction between the tendon and the surrounding structure. Okay, reduce friction. Okay, so that's the last slide for the first part of chapter 1. So, sabi nga dito, ang tulog na babawi, ang grade hindi. So, this is the first chapter pa lang. So, please make good. And this next chapter will be ready for the next session. Keep safe, everyone. Bursa is a lubricating device consisting of a closed fibrous sac lined with a delicate smooth membrane. So its walls are separated by a film of viscous fluid and found wherever tendons rub against bones, ligaments, or other tendons. So it is commonly found close to joints where the skin rubs against underlying bony structure. So in this picture we have here, this is the knee kasi nandito yung patella. Okay? One of the biggest floating bone. Then sa taas niya, you have here your suprapatellar bursa. Then you have here the prepatellar bursa in the superficial and deep infrapatellar bursa. Okay. So kung may bursa, meron ding sheaths, synovial sheaths. Ano ba tong synovial sheaths? It is a tubular bursa. Bursa pa rin siya. That surrounds naman a tendon. So binabalot niyo yung tendon. So the tendon invaginates the bursa from one side so that the tendon becomes suspended within the bursa by a mesotendon. So this mesotendon now enables blood vessels to enter the tendon along its course. So this occur where tendons pass under ligaments and retinacula and through osteofibrous channels or tunnels. Their function is to reduce friction between the tendon and the surrounding structure. Okay, reduce friction. Okay, so that's the last slide for the first part of chapter 1. So, sabi nga dito, ang tulog na babawi, ang grade hindi. So, this is the first chapter pa lang. So, please make good. Next chapter will be ready for the next session. Keep safe, everyone.